Aye. As we have a quorum, I'll call the meeting to order. Welcome to the Metro Plus Finance Committee meeting, Tuesday, June 9th. To begin with, start with old business and the adoption of the minutes from the March 25th, 2026 meeting. Do I have a motion to approve?
So moved.
Second. All in favor? Aye.
Aye.
With that adopted, we can move to the first action item, authorizing the submission of a resolution to the Board of Directors of New York City Health and Hospitals to authorize the Executive Director of MetroPlusHealth Plan, Inc. to execute best interest contract extensions with Prager Creative LLC and Bellwether LLC for outsourced creative marketing, media buying, digital marketing, and social media marketing in the amount of $25 million for a new total contract authority amount of $60 million, inclusive of 10% contingency. With that, Talia.
So MetroPlus outsources strategic creative marketing, media buying, digital marketing, and social media services to support our member growth, retention, and brand awareness initiatives. MetroPlus has utilized outsourced marketing and media services since 2007. Since 2021, these services have been provided through two vendors, Bellwether LLC and Prager Creative LLC. The original contracts with Bellwether and Prager for these services were competitively procured through an RFP process in 2021, and these contracts expire in August of 2026. MetroPlus is requesting an increase in authority in the amount of $25 million to support a 2-year best interest extension, inclusive of a 10% contingency. MetroPlus is requesting approval of best interest extensions to continue utilizing these vendors to ensure continuity of services, maintain strategic momentum, and avoid disruption to any ongoing marketing and member engagement initiatives. With current campaigns underway and member retention efforts serving as a primary organizational focus, MetroPlus determined that it was the best interest to maintain ongoing services with our current vendors. Additionally, we've evaluated current vendor pricing against market benchmarks and determined that the rates provided by both vendors remain competitive, reasonable, and aligned with prevailing market pricing. Both vendors have consistently delivered strong outcomes in driving increased brand consideration, strengthening acquisition performance, and providing measurable results. This is evidenced by sustained growth in brand consideration over time, steady call volumes with significantly improving lead quality, and a robust digital ROI of approximately 3-to-1 across a channel that represents 60% of the overall marketing budget. The increased spending authority request is broken out as follows. Our original authority from 2021 to 2026 was $20 million. That was across 5 years at an average annual spend of $4 million. We updated and asked for additional authority in 2023 because we saw an increased spend, upcoming increased spend in 25 and 26 for expanding our strategy for Gold, Medicare, and ethnic marketing. Currently, with the current contracts, our average annual spend ranges between 7 to 10 million. Our proposed extension and authority increase, which for 25 million would be for 2 years, and the average annual spend that we're projecting is 12.5 million. That includes increased campaigns, CPI costs, and 10% contingency. Our original authority was established in 2021 based on projected marketing and media needs at the time. In 2023, when we sought out additional authority, we saw that we were increasing our campaign and media activity, membership growth initiatives, retention efforts, and expanded digital marketing strategies. Specifically, we were setting up the landscape for 2025 and 2026, where our spending strategy and our marketing strategy was increasing to make up for Gold, Medicare, and ethnic marketing. So this additional 25 million will support a 2-year extension, capture anticipated business needs over the extension period, with continued investment in strategic marketing and digital media buying. We want to continue to support membership growth and retention efforts through our campaigns. The board approval request is a 2-year best interest contract extension with Prager Creative and Bellwether. The increased contract authority amount of 25 million is inclusive of a 10% contingency.
presentation. Does anybody have any questions?
Yeah, I'm a little bit confused about the spend in each year.
That's my fault. So.
Okay, so 2021, 22, 23, was that $4 million, those 2
Some
years?
average 4 million. Some of when we started in 21 and 22, it was a little bit less. So the money sort of like increase. We had one approved authority, so we were balancing the budget. But at the towards the end of 2023, going into 24 and 25, there was a rebranding campaign and brand awareness and heightened strategic marketing around control the Medicare we were starting to do. And so that's when we saw that the costs were going to go up because we are budgeting increased spending on this brand awareness.
That was 24,
That was
25,
24, yes.
26?
So basically, in end of 23 in December was when we went to get increased authority. 24 was when we were planning this increase in marketing and getting that going.
Right.
For 25 and 26, which was really right now and the year previous,
Right.
which was really focused about expanding our strategy for gold, Medicare, and also starting ethnic marketing, which is
Okay, so those, because you have authority, 35 million. Of that 35 million, how much was spent in, and it's going to be projected to be spent in 25 and 26?
we're gonna get very close to the exact
How
35.
much each year?
In each year, so right now in 20 from the contracts fall on in August to August, so they cross years.
Okay.
But currently our spending with the two vendors, it goes about close to 10 million. It's about 9 and change. We
Okay.
spend more with Prager because they're a media buying vendor. And we spend less with Bellwether, but that's because they handle the strategic marketing.
And now it's going to be going up to 12.5 million for 2 years.
Correct.
Yes.
We wanted to incorporate CPI because media buying, while we have rates, their range is, and they could go up given what's going on. And we also wanted to include a contingency in there as well, in case as we continue to grow. Hopefully, we continue to strategize and create more campaigns. We'll have enough authority to get us through the 2 years.
And these spend rates are already assumed in the upcoming in the budget
Okay.
for the year, so it's not going to be
Yes,
a hit
correct.
to the system.
Then in 26, in the 26 budget, we did include a contingency. When we were creating the 26 budget, we were still under the impression of doing an RFP and perhaps getting new vendors. We did launch the RFP, but we decided to cancel it because we just saw that the rates are we have the rates that we have with our current vendors,
Right.
and also just the work that we've done with them.
Right.
It made sense to stay with who we had. But we did account for in the budget if we needed to increase, so there is a contingency in it, so we're covered for 26.
Well, I think it's good that the extension is only for 2 years and you reserve the right at that point if you need to RFP it.
And we can see if it's running another RFP, if it's maybe doing an RFI, or just seeing how the market's shifting and who the vendors are in there.
Okay, and so Talia, the 4.5 million that we saw today was for gold, was for a totally different purpose than this.
That's right.
Okay.
The other thought is, as we discussed earlier in another committee, despite the communication from the state, our members are not really aware of what's happening. This is just EP5. Now, as we think about what's going to happen in 27, I do see us not just over communicating about the changes, because now they're going to impact massively. Not that 31,000 is not massive, but even more massively. I do see potentially using some portion of the budget around retention efforts. I mean, a lot of it, obviously, we never clearly differentiate between acquisition and retention. But again, based on what was discussed, we will need to supplement whatever communication that will be coming from the state, not just with our communication, but probably some advertising to bring this to awareness. Now, will we be also serving our competition? Yes, so be it. But I think it's really, really important to bring this to the forefront of people awareness because they're just going to show up and not have access.
Yeah, you have to find a way to differentiate our communication from the state's communication, which is more heavily regulatory based, right? And in a way that, captures their attention and how kind of dire, for lack of a better term, but the situation is. Um, yeah, as much as possible, you don't want them to know the day they go in for a doctor's appointment.
Right.
Are there any other questions? If not,
No,
I'd
thank
ask for
you.
a motion to approve.
So moved.
Second. All in favor? Aye.
Aye.
Motion is approved. And with that, I take to Lauren to discuss the financial report.
Sure, so this is Q1 close for 2026. This is the last quarter of the 25-26 state fiscal year at the state level. So for Q1, our utilization are being characterized by elevated ED visits and medical admissions. We typically and historically have seen a seasonal flu and other respiratory illness. We are and have built our forecast with that in place. Based on what we're seeing in our claims experience, we have not seen the trends materialize to the same level. So anticipating to have a Q1 with a bit of a release where any spiked expense in inpatient or ED that is within our Q1 close will soften. So with that, our overall inpatient medical expense and ED visits remain stable in Q1. We're seeing our Medicare population overall experience a lower admission rate that is a 10% change. And we are also seeing in January and February 2026 an increase in our overall population that is helping support that. Our population for outpatient, for behavioral health expense continues to be a strong utilization category of service across our Medicaid, CHIP, Gold, and Essential Plan members. We are seeing that it is contributed by utilization, more utilizers, and there is a continued rate increase in behavioral health buckets for COLA each year. And then for Health Home, which still carries on in 2026, those expenses are increasing. For our HARP line of business, where we see the same number of utilizers, but with less members, the overall increase is upticking. And then for Medicaid, we saw actual more members utilizing the Health Home program with increased utilization. And for the PIC SNP, we have additional utilization there and assessment expense, which is emerging. As we, go through the single fiscal intermediary collapse, we are seeing a stabilization in Q1 on our personal care and CDPAP services. It is not the savings in the personal care as the state alluded may be driving the savings over time, but we are stable within those service category buckets.
We don't really understand the health home expenses.
Mhm.
Why suddenly, out of the blue, it's so popular? It hasn't been popular for a whole decade. So we did look to see if there is a particular provider who is more prominent than others, and to nobody's surprise, there is. So we are looking into it. We also know we're not alone in this spike. We know that at least another plan communicated that they're also seeing. Well, probably there is more than that, but we know for a fact that at least another plan is seeing the same increase, and it's completely open. There is no on this one, so it's an opportunity for good doers and for others.
Health Home used to be a pass-through program. It was a demonstration project at the state level that evolved to the health home being absorbed into our overall capitation rate. So plans are now at risk for the services that are yielded here, but it has pretty much been a low adoption program until Q1 of 26. We're seeing it rise again. But small when you compare it to all the other buckets, but it is making movement there, so we have to keep an eye on
Yeah, I mean, absolute number, small, percentage wise. It's
Right.
like huge, yeah.
it.
Yeah.
Next slide. So this is revenue updates that are coming down, the pipeline starting in April. So Q1 close does not have these rates adopted. They will start as part of our Q2 close. So while the rate is increasing 0.5% overall in the Medicaid line of business, when you compare that to our overall forecast assumptions, that's a reduction of 3.1%. The risk scores declined in this population. We did assume a flat acuity across the board in our forecast. What I will talk to you a little bit in a few slides about what we're seeing in those risk scores. The state said that a base trend of 2.4% was acceptable for the Medicaid population. For Q1 2026, we're running 4.5%. We are also, anticipating that number to rise to 6 as the year completes itself. So for the state to hold that at 2.4%, we don't believe they're taking in the actual value of what's happening in the region and the acuity of the overall population. So we, as a coalition, are arguing the rate increase here. They also said they increased the range from the low to the midpoint, but again, that is challenging to understand how that was achieved with the 2.4% number. And then enrollments, as we talked about earlier, but that is deviating from forecast about 2.4%. We're seeing that, the base is lower on the overall new growth to acquisitions. Retention and recertification is our number one strategy to maintain, though it is more of a steep climb, and we are seeing, disenrollments continue to occur. So overall impact on just the Medicaid line of business alone is almost $104 million. Next slide.
Is that the highest it's been in some time, or?
Yeah, I guess through the public health emergency, we've had pretty consistent increases in rates. So yes, this is the largest haircut to forecast that we've seen.
Especially compared to trend.
Oh, right. For the hard line of business, we see a reduction of 0.8%. This is versus a reduction of 1.4% to forecast. This population is also seeing our risk scores decline. We did have a flat acuity assumption, knowing that we were the most acute HARP in the region, and social determinants helping our strategy. Other health plans have seemingly caught up. Our base trend here of 2.8% is actually above what we had targeted. So that is good for this line of business. We're seeing the medical expenses creep month over month. However, enrollment remains a challenge here, and it is about 10,000 lives in this program. And as if lives continue to deplete from the HARP, it becomes more unstable. So the overall revenue impact here is $9.2 million. Next slide. And then SNP, it is a great line of business and does great things, and they have positive rates based on their experience evaluation of the population. So rates are up 1.3%, but we had the SNP product lines aligned with our Medicaid product. And so here we did have a miss to forecast of about 5.5%. In 2026 March, we did lose about 300 of our lives. So we have about 4,500, I'm sorry, overall HIV SNP members. So the unwind of the 300 duals is a challenge. However, we are seeing our homeless initiative with our Medicaid population, conversion into the HIV SNP line of business to assure they're accessing the right benefit, the right product offering for their needs. And so we are seeing about 600 folks converted into that product. Overall here, it's a negative impact to the product, but still a very strong overall line of business for the plan. So a minus 18.8 million.
Lauren, what's the difference in premium between homeless and HIV positive?
Yeah. $4,000.
$4,000 is the delta? But is it per month? The 4,000 delta?
You have SSI, and if TANF, it's lower, it's maybe 2,000, right? Or 6,000.
Can you just follow up with the actual numbers? This is not ringing a bell. Okay. Sorry, if they're both homeless and HIV positive, they're in the HIV bucket?
If you're positive,
um,
We know that for a fact.
Yes, you have to validate the viral load in order for them to be in the actual HIV here.
So presumably some people could be sitting in the homeless just without a viral load?
Don't believe so. The HIV SNP team manages each person, right?
as part of their processes, so.
Right.
Clean separation?
I would argue that it's a clean separation. We will validate and double check, of course, but they do this on the per member who joins the HIV SNP program.
Let's just revalidate. I know sometimes we had issues accessing viral load from the state. So the viral load that we obviously get through claims, but we also were supplementing by information coming from the state. And sometimes I know that information has not been stable. So I just want to make sure we really optimize it.
So each year, the state, as part of our rate package, issues a plan risk score for the acuity of the overall population. So for the Medicaid population, what you see on the screen here, each of the plans within our region, our relative risk score, which is the acuity of our overall Medicaid lives, and the change to that score in the column right next to it. So the last two lines there, you will see, one of the national carriers had an increase of 10.5% increase. Because this is a net neutral event, their gains are the other regional carriers' losses. And there was a new factor add-on to the methodology for HCBS behavioral health services that pulled the weight towards those, the membership that they must serve in that bucket. So unfortunately, they had a 25% increase in both of those cells, and that overall reduced the MetroPlus Medicaid risk score by 1.9%. On the HARP side, that story is about a 3.4% overall change. We're just seeing that membership reduce as the leavers and stayers are shifting their acuity towards the base, as well as the social determinants screening catch up for the overall region. So there's some additional changes that are coming down the pipeline. Those include April 25 and April 26 rate packages. We will also be seeing updates for HR1, including Medicaid work requirements yet to be released. And we will see an essential plan mid-year rate update. This is supposed to be isolated to the elimination of the EP5 group effective 7/1/26, but we haven't heard a timeline to when they will be released to the payers.
Are some states moving forward with the Medicaid work requirements, even without having rules laid out yet? Do you know?
So Raven noted earlier late last week that the federal government just issued the guidance that the states are to use to administer how work requirements will be achieved in each state.
Mhm.
And I know that, that's, New York is going through that right now. But essentially, the federal government is putting the onus on the states to acquire the information that validates the work requirements
Right.
with limited participation from the plan side.
Hmm.
So we'll see.
Hmm.
Next slide. So moving on, the enrollments in April 2026, but both unfavorable to our original projections. We are seeing, right, the enrollment change of minus 1.4% versus forecast, and those are larger than expected declines in Medicaid and CHIP. It's small, but it's still meaningful to the P&L. And then on top of that, you have a 1.6% reduction in our overall rates that we just went through. So the total revenue impact to our forecast is valued at $113 million. Back to Q1. So for our plan across the 11 lines of business, we closed Q1 with $93.3 million of net income. And so where the split here is, we have current year operating budget of about $40 million, which includes an MCO tax from prior year that is being pulled forward. And then we had two large releases, one on the ACR money that has come through, and then also we had an IBNR release, which is driving the prior period orange box comparison. From the P&L perspective, we are doing well, across some lines of business, but we are bracing now for the back end of the year where Medicaid will have, more of a challenging time in its premium over trend, trying to keep up with the trends that is happening to our members. Some of our other lines of business, all positive, are showing, improved Q1, which sets us up also for the back end of 2026. Next slide. So here is the all lines of business versus the forecast. So that first column is our actual of how we closed with 671,584 lives. The revenue line, 3 lines down, we have slightly higher revenue PMPM than we had forecasted. And we did take a look with the rate changes that we know are coming down the pipeline and the membership shift that we did have through Q1, that the revenue will essentially remain, stable, if not slightly better through the rest of this year. And then on the expense side, we saw more favorable. As I mentioned, we had about a 6% trend that was loaded into our forecast, operating at about 4.5 right now, which then in turns the next line into your value-based payment savings between our two BBP partners. And that number is stronger than anticipated as a result of the lower expenses than anticipated. Admin on par. We do anticipate to spend our administrative budget as planned. So for Q1, that is holding. Investment income also just slightly better in Q1 than anticipated. That will normalize as we carve the rest of the year out. And then the big state-directed payments and MCO tax in the current year, that was just not known at the time we put the forecast together, and not anticipating that to grow, but to normalize as we round out the year. So ultimately, looking at a plan operating adjusted income of $19.90, factor in the two aggregate write-ins for prior year, which is IBNR release and ACR funding, and our net income for the organization is about $45 or 93.3. Admin, our total admin budget slightly unfavorable. We understand now the favorability. our unfavorability was due to a pension payment that was for 8 months posted in March of 2026. That will normalize as the remaining months play out, but it did, over than what we anticipated for Q1. Our value-based payment performance is doing well. H&H, you can see at the top bucket there, we have, H&H, MetroPlus, and our Somos providers all doing well in Q1. So that sets us up for the best place to continue the 26th March. For Somos, there are gateways and metrics that have to be met as well as on the H&H in order to maintain these values. So for Q1 2026, significant improvement from this time last year. And when we were at this time last year, we didn't have any of the value of the increase to the Medicaid rates that came through in the last state fiscal year, which was almost 9% of an increase. And then on membership, we are marching along 2% variance to our forecast, which I think is, best place to be. And we will continue to decline as the year progresses. That is anticipated, but with stability, understanding our, maintaining our retention, understanding that new acquisitions is, more of a switcher's game than finding net new individuals. And our stability is proof in our market share. So for the Medicaid managed care, our largest line of business, we are holding at 15.8%, which is 0.1% behind where we were in December of 25. So small movement, but largely stable. Even our CHIP line of business is making a mark slightly better than where we ended 2025. And looking to continue across that. The other lines of business are holding steady. And with that, we have a number of procurements that are coming down the pipeline just for awareness and their start dates. So there are EDI, SIU, and OCR release dates that will be posted for solicitation, and the length of the contract terms to which we are securing services for. And lastly, our provider contracting strategy. So, you've heard us say we have over 34,000 providers in our wheelhouse for our members for access and choice, and always looking to improve, enhance, and give our members the best options available to seek care. And this just gives you a distribution of where our providers are located, which does match the footprint of our overall population. So there is a seemingly match, to where our members live versus where they are.
Mostly except for Manhattan, because we have relatively low membership in Manhattan.
Well, all the big hospitals.
Exactly.
So,
Yeah.
And so here, we also have goals in our division. We have added over 1,000 new providers to the network in 2026 alone. So through May, this gives you just a landscape of where they are. A subset of these providers are tied to specialties to which we are focused on, because they are hard to access for our population, and timing is everything. So we want to assure that we have, again, the most choice and access for our population, where we're seeing challenges and our members are communicating, their wait times are strained for some of these services. And it's cardiology and gastroenterology. It runs OBGYN is another. So that concludes Q1. I'll open for questions.
There are no other questions. Do we have any other new business?
I do, oh, I'm sorry. I'd like to just introduce both Bob Nolan, who's our new VP of Contracting, who has joined our team, and Jim Maidlinger, also our VP of Actuarial Services that we have brought in-house to what is the greatest division.
Great.
Welcome aboard.
That's right. Thank you all.
Thank you.
You'll have a new business, side.
All right, so moved. Aye.
So moved.